All right. Thank you, everybody, for registering for this New Jersey Food Security Strategic Plan uh, and Implementation Toolkit webinar. I'll be your co-host for the webinar. I'm Mark. I'm your food security advocate. I'll be joined by Dr. Jenny Schrum, the Director of Research and Evaluation for the office. We are so excited that you are all here with us this afternoon. Next slide, please. Quick agenda today so that everybody can see. I will start us off with just giving a quick background. I know some of you are new and have not worked as much with OFSA. For those of you that are joining us for the very first time and learning about OFSA for the first time, thank you for joining us. So I will go through a quick background of OFSA. And then from there, you will hear from Dr. Jenny. She'll go through an overview of the strategic plan, and then she will do the implementation toolkit. We will have a short question and answer session as well. And you will be able to put questions in the chat. And then Dr. Jenny will walk us all through next steps for the strategic plan. Next slide, please. Again, formal introductions. I am Mark. I am your food security advocate for the state of New Jersey. I took office at the end of September in 2022. I am joined here by Dr. Jenny Schrum, our Director of Research and Evaluation Strategy at the office, who oversees all national, state level, and localized research and evaluation efforts. Next slide, please. Many of you have heard me say this, but for those of you that are hearing it for the very first time, OFSA is unique, right? We are codified. OFSA was created through legislation that was passed in 2021. And as I mentioned, I took office at the end of 2022. Our enabling legislation for the office gives us several legislative mandates. What you are seeing on screen is the legislative mandate from our enabling legislation that instructs OFSA to create the food security strategic plan that we will be talking about today. Some key things to point out in the legislative mandate, and this is a lot of the work that many of you have partnered with OFSA on, is we did have to identify gaps in the services and all the work that we're doing, and use everything that we were learning in partnership with all of you and everything that we were identifying to create this strategic plan. Next slide, please. How did we create the plan? I think that's very important as we go into Dr. Jenny leading us into a deep dive of the strategic plan and the toolkit. So when OFSA was created in 2021, and I began the work in 2022, I received a lot of questions from people saying, when are you going to start the strategic plan? When are you going to start the strategic plan? Because a lot of folks that were involved in advocating for the office, including myself, one of the things that we all were asking for when we were signing the petitions to create this office was the creation of a strategic plan. It was on purpose that OFSA did not create and release the plan until the beginning of 2026. When we began our work at the end of 2022, the focus was really on two things, centering OFSA's work on research, publicly available data, and community. One of the things that I remember saying to the Murphy administration when we started is that there's already a lot of amazing work happening in New Jersey. OFSA should only create something if and when necessary. And I used to say, especially in 2022 and 2023, to both the legislature and the administration, give me time. We have to community build. So from 2022 to 2024, it was about meeting you all and creating line of sight, not just between our office and you all, but between each other. Right? It was important that we all saw each other in this work and that you all saw each other in this work. And the litmus test, actually, for whether or not we were ready to begin the strategic planning process was October of 2024, when we held the first annual statewide food security summit. I joked at that time that if nobody shows up to this summit, we are not doing strategic planning. And lo and behold, we had more than 280 people on site and more than 100 people online. And that's when I told the Murphy administration, we are ready to start the strategic planning process. Next slide, please. As we were creating this plan, the strategic plan, this was the vision that OFSA laid out as we were putting everything together. We wanted a New Jersey food system where all people at all times have continual and resilient access to foods that meet their needs and preferences now and for generations to come. And we also wanted every sector and community member to see themselves as integral. You are important to this work. All of you that are on this webinar, all of our national partners, our state partners, our county partners, our municipal partners, the community leaders and community members that are here, you are important to this work, and it was incredibly important to OFSA that you would be able to see yourselves continuously in everything that we were doing, especially this plan. Next slide, please. These were some of the commitments and values that especially Dr. Jenny led OFSA through as we were drafting this plan through this 1.5 year long process. And I commend her for her leadership in bringing us to where we are now. I'm not going to go through all of them, but just a few things to point out. Number one, as I had said before, using community-informed approaches. You all, as the leaders doing the hard work, and the hard work are the experts on what New Jersey can and should be doing, and the families you are serving are the experts on what they need. So it was incredibly important that we were lifting up community-informed approaches. I also want to highlight number 3. This plan prioritizes a systems change orientation. We have to build better. We have to build different. If the goal of our strategic planning and our collective work is to keep the same thing going, then we are going to miss an opportunity together, because I know that you know that New Jerseyans need more help and need better systems. And finally, I want to lift up number 6, that we have to support data-driven continuous improvement. Data and grounding our work in data brings us together and helps us to identify the problem. We can't fight the enemy if we don't know the enemy. So we have to know food insecurity and our work through data. So these are some of our commitments and values that have led to the creation of the strategic plan and now the implementation toolkit. The plan is a macro focus. The toolkit is for all of us to start executing together. Next slide. Without further ado, I would like to turn it over to the person who led the drafting of the strategic plan and the accompanying implementation toolkit. I'd like to turn it over to Dr. Jenny Schrum.
Amazing. Thanks, Mark. Hi, everyone. So excited to see you today. Strategic planning took about 1.5 years, so I can't believe we're here talking about the toolkit now. So first, I want to give kind of a really quick overview of the actual strategic plan. I know several of you here on this call could probably read the strategic plan back to me by memory because you've come to so many of these listening sessions and webinars and conversations, but we have some new people here as well. So our strategic plan process. So here we have our overall process for the strategic plan. The development of the strategic plan was grounded in an inclusive and evidence-driven process that was designed to reflect the priorities and strengths of New Jersey's diverse food system. The process combines statewide data analysis, community perspectives, expert input, and extensive cross-sector collaboration to build a comprehensive understanding of the conditions shaping food security across the state. From the very beginning, as Mark talked about, OFSA prioritized community building as a core part of the planning process. So let's break this down and look at the phases of creating our strategic plan and now our current efforts around implementation and monitoring. So research and evidence review. OFSA and its partners reviewed more than 20 existing food security related recommendation reports to understand the current landscape and build on existing recommendations here in New Jersey. At the same time, the Center for Nutrition and Health Impact, our great research partners, conducted an original study of food security across the state using the 6 dimensions of food security framework. And if anyone here is not familiar with the 6 dimensions of food security, we talk about it all the time. You can find it in the strategic plan and all over our website and a lot of our materials. So together, all these efforts helped identify statewide trends as well as differences across communities by combining existing research, new analysis, practitioner expertise, and community perspectives. The strategic plan reflects both scientific knowledge and real-world experience. We then had our fabulous executive committee and their expert guidance. So we had a multidisciplinary executive committee that helped to guide the development of the strategic plan. The committee included representatives from state agencies, community organizations, agriculture, philanthropy, charitable food organizations, healthcare, and higher education. Throughout 2025, members met regularly to review data, identify priority focus areas, and refine strategies. They also participated in working groups and surveys to help shape the strategic plan's direction, including aligning strategies with current initiatives and funding opportunities that we have in the state. So this collaborative process ensured that the final strategies are very ambitious, but also achievable. We then had some community feedback and resident perspectives. So community input was essential as we were developing the strategic plan. OFSA incorporated insights from statewide conversations, storytelling initiatives, and survey feedback. This was both virtual and in-person convenings that gave partners and residents opportunities to respond to ideas, share their experiences, and identify gaps in proposed approaches. In summer 2025, OFSA released a draft overview of the strategic plan, and we invited community feedback from across the state. We had more than 100 people participate in that feedback, and their input directly informed some refinement and structure for the final focus areas and strategies we have in the plan. The result is a strategic plan that is both research informed and community driven. So the strategic plan officially launched in February 2026, and the toolkit launched this March 2026, moving us into the implementation and monitoring phase. So the plan, toolkit, and additional technical assistance from OFSA, like this webinar, helps partners see themselves in food security work and translate the collectively defined focus areas and strategies that we're going to go over from the strategic plan into locally tailored tactics with action plans. And so looking ahead, OFSA is going to be tracking how the strategic plan is being implemented across the state and across sectors. This is going to include a commitments process that we'll talk about more later that'll help highlight projects that are planned or are underway. And we'll talk about that at the very end of this webinar. Next slide, please. So here we have our final strategic plan focus areas that we developed through that process. There are 5 main areas in our plan, and we hope to advance the work within all of them. So these areas include focus area 1, which is around data-informed decision-making and optimization. Focus area 2 thinks about local food system efforts and infrastructure. Focus area 3 is around local partnerships and collaboration around community-based work. Focus area 4 is large-scale sector agency approaches to our federal and state nutrition programs. And focus area 5 is long-term resilience and sustainability in our food system. And you can access the full strategic plan through that QR code and via our website. It's nice and long. You guys can take a lot of time to go through it. Next slide, please. Okay, now that we level set on the strategic plan itself, I'm going to walk you through the implementation planning toolkit and how it can support your work and align it with the strategic plan. We're going to start with a brief overview of the toolkit, then spend time walking through each step using a hypothetical example. And I'd also like to shout out and thank the Center for Nutrition and Health Impact team and Hunger Solutions for their incredible efforts helping us build out this toolkit over the past couple months. Next slide. As I shared earlier, the strategic plan sets a shared direction for advancing food security across New Jersey. So the strategic plan is that top half of the pyramid, okay? It outlines focus areas and strategies, but it does not prescribe specific actions. Instead, it creates space for communities, organizations, and partners to determine what makes most sense locally. You guys know best. So then this is where the toolkit comes in. This is our bottom half of the pyramid. The toolkit is designed to help you move from those broader strategies to a concrete program action plan. It supports thinking through each step of planning, from identifying community needs, exploring potential tactics to address that need, and planning for a practical implementation. Next slide. Okay. So the toolkit is designed to be flexible and accessible for a wide range of partners. It can be used by organizations, coalitions, and individuals across sectors. Anyone who's working to advance food security can see themselves in this toolkit. It's also adaptable to where you are in your work. You can use it to plan a new program from the ground up, or you can use it to document and strengthen an existing effort. The toolkit is designed to focus on one program at a time, so it helps you go deeper and build a clear, actionable plan. You can move through the steps in order, or you can jump to the sections that are most relevant to your current needs. It's important to note that the toolkit is a resource, not a requirement. You don't need to complete the toolkit to advance the strategic plan. However, if you use it, it can help you connect your local efforts to the broader statewide movement to advance food security, which helps us ensure that individual programs contribute to a more coordinated and impactful system overall, which I know we all care about. Next slide. Okay, our toolkit follows a 6-step process to help translate strategy into action. Step 1, assess the need. Step 2, pick a strategy and tactic. Step 3, envision the program. Step 4, build a logic model. Step 5, plan for evaluation. And step 6, plan for action. All together, these steps help ensure that your program is grounded in community needs, aligned with available resources, and it's positioned to achieve meaningful outcomes. Next slide. So if you've looked in our toolkit, each step is designed to be practical and usable. So you'll see a consistent structure throughout, and the steps are all marked with these color and icon breakdowns. First, each step includes a brief explanation of why the step matters. Then you'll have a checklist that will help you guide your completion of the step. You'll also find guiding questions and tips to support discussion and decision-making with your team. Each step also includes tools and templates you can use directly. We'll list these templates on the next slide. The toolkit also provides links to more resources on each step, so you can choose how deep you want to explore additional insights and support. Finally, each step includes a model example to show what the process can look like in practice. The model example that's written in the toolkit is different than the one we're going to talk about today, so you'll have a few examples to reference going forward when you use the toolkit. Next slide. As you begin working with the toolkit, it's helpful to understand how the materials are organized and how they work together. So you're going to have 3 main documents that you'll want to use throughout the process. You're going to have your overall strategic plan document. You're going to have the actual toolkit PDF, which walks you step by step through the planning process. And then third, you'll have a set of the editable templates, which are designed to help you apply each step to your own work. Within the toolkit, templates are organized by step, as you see listed on the slide. And as you move through the process, you'll have a corresponding tool to capture your thinking and decisions. And you can download these templates individually based on what you need, or you can access them all together in a single document. Next slide. All right, I hope everyone has snacks and water. We're going to go step by step through our toolkit with a model example. Okay, so now that we have an overview of what is in the toolkit, now, to make this more concrete, we'll go through each step of the toolkit using a model example. So let's define the model example now so that when we go into it, we'll all kind of have the same mindset together. So in our hypothetical scenario, we have a countywide multi-sector coalition that's working together as the implementation team. This coalition includes food pantry staff, healthcare providers, a SNAP navigator, local WIC clinic staff, and a childcare center. Through the steps outlined in the toolkit, the coalition is going to align on developing a program around screening and referrals to food resources. This involves using a quick tool to identify food needs and opportunities and then connect those families to supports, including federal nutrition programs and community resources. So I want to note that the example we're looking at today is for illustrative purposes only. It's pretty high level so that you can understand how to use the toolkit, but by no means is it teased out to a fully developed program. Next slide. Okay. So step one is about building a clear and shared understanding of what you're trying to do and why. At this stage, you're defining who your program is for, where it will take place, and what it will focus on. There's four sub-steps to this step. First, identifying your program's focus, then identifying your planning team. Third, identifying and prioritizing community needs. And last, describing the drivers, needed actions, and expected changes. The toolkit includes templates to support this work, including a program focus and planning team template and a community needs table template. Next slide. Let's think about how this step might take shape in practice. In our example, the coalition selects focus area 3, build and support local partnerships to advance community-driven food security approaches. And they decide to focus specifically on families with young children based on the coalition's expertise and who their organizations primarily serve already. The planning team is made up of the coalition members we mentioned earlier, bringing together multiple sectors and perspectives. To understand community needs, they draw on several info sources, such as public data and community listening sessions. This combination of data and lived experience helps create a more complete picture of what families are facing and where gaps exist. From here, the coalition would begin to prioritize those needs and start identifying what is driving them, what actions could address them, and what changes they hope to see. Next slide. This slide shows that community needs table template found in the toolkit, and we filled it out with our model. So in our example, one of the coalition's identified community needs is families with young children are not always aware of the resources available to them and often do not have the time to explore options or complete applications on their own. They then consider the setting and drivers of this need. Why is this happening? This challenge shows up across both healthcare and community settings. It is shaped by a lack of standardized screening, disconnected referral systems, and limited capacity across partners. At the same time, the coalition identifies strong community assets to build from. There's an existing network of healthcare providers and childcare partners, along with food pantries and federal nutrition programs like SNAP and WIC already operating in the community. The county coalition itself is also a very important asset. From there, the group defines the change required. What do we want to see happen? In this case, that includes increasing awareness of available resources and improving families' ability to navigate program applications and requirements. Finally, they outline the intended impacts. In the short term, we're hoping to see increased knowledge among families with young children about available programs and resources. And over the longer term, we're hoping that change leads to increased use of those resources and improved food security. So given the time that we have today, we're showing one community need, that one row that the coalition will focus on. In reality, your planning team may want to explore more than one community need, so having multiple rows. But we really recommend that you select one priority need before you move on to step 2. So to help narrow it down, you'll want to consider what's the most urgent, what has the greatest impact, if it affects some groups more than others, or is it timely to address? And you also really want to think about whether addressing the need is realistic. Next slide. Now that you've selected your priority need, step 2 focuses on deciding what your program will actually do. This step is about selecting a strategy from the strategic plan and identifying the specific tactic or tactics that will help address the need that you just identified. It's also where you begin to ground your ideas in reality by thinking through your team's capacity, the resources required, and the factors that could influence implementation. There are 3 main parts to this step. First, identifying your strategy and specific tactics. Second, assessing your capacity and resource needs. And third, choosing among the tactics that are most feasible for your team. The strategy selection template is designed to help you document each of these components. Next slide. Great. So in addition to the strategy selection template, the toolkit includes a searchable library of tactics to address food insecurity. This slide shows us scrolling through that library. The library provides you with evidence-informed approaches that show different ways the strategy you chose from within the strategic plan can be put into practice. Each tactic includes a short description, model examples, supporting resources, and a summary of the evidence behind it. You can explore the full library, or you can look just within your selected focus area, because we have tactics tagged by focus area, strategy, and dimension of food security. So you can sort according to what you're looking for. For many teams, this library can help move the conversation from what should we do to what could this look like in practice. It's important to note, and I really want to stress, that the library is not exhaustive. It's meant to serve as a starting point to help you explore options, learn from existing efforts, and adapt ideas to fit your own context. You can consider modifying a tactic if necessary to best fit your community. If a desired tactic is not listed, we encourage you to move forward with it and contact OFSA for planning support if you're interested in that. Next slide. Okay, let's walk through how this looks in our model example. Our coalition begins with the selected focus area, building and supporting local partnerships to advance community-driven food security approaches, and their defined community need. Families with young children are not always aware of available resources and may not have time to navigate them. From there, they explore the strategic plan and identify a strategy that aligns with this need. They found strategy 3.4, screening and referrals. Next, they select a specific tactic from the library, launching a multi-site standardized screening and referral process. This tactic builds directly on the need identified in step 1 and leverages the coalition's cross-sector partnerships. The team then considers what it will take to implement this tactic. They identify key capacity and resource needs, including staff training, a referral platform, coordination across partners, and data sharing agreements. Finally, they conduct a SWOT analysis, looking at their strengths and weaknesses internally, as well as external opportunities and potential challenges. Again, we're showing one example here, but a planning team in reality may fill in multiple roles, proposing and exploring various strategies and tactics that address the need that they identified in step 1. The SWOT analysis is really useful to help narrow down the options and pick one tactic. We really recommend choosing one, at most 2 tactics. This process helps you move from a broad idea to a more focused and feasible approach, one that fits your capacity and positions you for success. Next slide. Now that we've selected our strategy and tactic, step 3 focuses on picturing how the work will actually take shape. The purpose of step 3 is to move from a selected tactic to a more concrete understanding of how the program will function in reality. We're almost at the bottom of our pyramid. This step begins by learning from others. You'll look at similar efforts, review examples, identify what has worked well, and where challenges have emerged. From there, you'll start to map out your own program by identifying the key activities, the sequence that they will happen in, and the conditions that will support successful implementation. There are 2 main parts to this step. First, building off what others have done, and second, sketching out your program. The Envision the Program template helps organize this thinking into a clear, actionable structure. Next slide. To build off of what others have done, you can explore similar programs and resources. In our example, the coalition goes through the toolkit's library of tactics, exploring the real-world examples linked in the spreadsheet. They also review example programs from other organizations. Finally, they look at implementation best practices that have supported success from similar programs. Implementation best practices are things you can do to improve the success and sustainability of the activities in your tactic. Some common implementation best practices that may be relevant for all of us could include engaging community members and strengthening partnerships early on, establishing a clear communication, management, and decision-making structure, or creating internal guidance tools and protocols so that screening and referrals are consistent across settings. So this step is about learning, adapting, and setting a strong foundation before moving into full program design. Next slide. Next, the coalition begins to sketch out their program activities and best practices that will support them. So this slide shows part of the Envision the Program template and examples of the activities and best practices our example might complete. Our coalition identified several key activities. First, developing a standardized screening and referral process using an existing referral platform to support coordination. Second, training providers across settings on how to implement the screening and referrals. And third, monitoring screening and referral activity, including whether families successfully connect to programs. For each of these activities, they also identified implementation best practices to strengthen their approach. For example, they will develop educational materials for families. They'll also provide training for facilitators to ensure consistency in how the program is delivered. And to support continuous improvement, they're going to create a dashboard to visualize data and share progress with partners. At this stage, the program is starting to really take shape. It's not the final plan, but it has specific activities that can be edited with community and partner input. Next slide. Once you get to step 4, you've defined your need, you selected your approach, and you outlined how the program will work. Step 4 brings those pieces together into a clear structure that shows how your program is expected to create change. A logic model is a simple visual tool that connects what you invest, what you do, and what you expect to happen as a result. It tells the story of your program. Importantly, the completed logic model serves as the justification for your program. It'll show how your activities are expected to lead to meaningful outcomes. There are 2 main parts of this step. First, becoming familiar with what makes a strong logic model. And second, filling in your own logic model using the template. Many teams find it helpful to start filling out the logic model with the outcomes, the things you want to achieve, and then work backward to identify the activities, outputs, and inputs needed to get there. Next slide. In our example, the coalition uses a logic model to clearly map the relationship between the resources, activities, and intended results. There are several key components. Inputs are the resources you bring into the program. These are things like staff, funding, tools, partnerships. Activities are what you do with those resources, the core actions that make up your program. Outputs are the direct and measurable results of those activities. These can be things like the number of people reached or the services delivered. Outcomes reflect the changes you expect to see as a result of your work. These are often described over time, short, medium, and long term. And finally, assumptions and external factors help you name what conditions need to hold true for you to be successful and what outside influences could affect your program. Together, all these components create a clear and connected picture of how your program is intended to work. Next slide. Okay, I love a logic model. Here we go. So let's explore how this comes together. This slide shows an example of a completed logic model template. For inputs, the coalition identifies key resources, including a multi-sector partnership, program staff, validated screening tools, an existing referral platform, and funding. These inputs then support a set of core activities, including developing a screening and referral process, training providers across sector, distributing educational materials, and monitoring how screening and referrals are working. From these activities, they define measurable outputs. This includes the number of trainings conducted and providers trained, the number of sites doing screenings, the number of referrals made, and the number of guidance documents produced. They then outline outcomes over time. In the short term, they're expecting to see increased provider knowledge and confidence, along with greater awareness among families of available resources. In the medium term, they anticipate increased enrollment in programs like SNAP and WIC and a stronger use of data to improve the program. And over the long term, the goal is improved food security for families with young children, along with a stronger system for connecting families to resources. The coalition also identified those key assumptions, like families engaging with referrals and providers having the capacity to integrate screening into their real workflows. And they also name external factors that could influence them, including policy changes, funding availability, and tech limitations. When we put all this together, the coalition creates a clear picture of how their program is expected to work. Next slide. Now that we've mapped how our program is expected to work, step 5 focuses on how you will know if it's working. Evaluation is the process of gathering and reviewing information to understand how a program is implemented, the quality of that implementation, and its impact over time. The purpose of this step is to define clear evaluation questions and objectives, and then identify how you will answer those questions using data. There's 3 main parts to this step. First, drafting evaluation questions that are clear, focused, and answerable. Then determining how you'll answer those questions by identifying indicators and measurement tools. And last, documenting your objectives, what you plan to achieve and by when. The evaluation plan template helps bring these pieces together in a structured format. Next slide. The toolkit outlines instructions for developing both process and outcome evaluation questions. We'll go through examples of each with our model, but first let's define these terms. Process evaluation looks at how the program is being implemented. It helps answer questions like, are we doing what we plan to do? Are partners able to carry out the activities as intended? Outcome evaluation focuses on what changes occur as a result of the program. It helps answer questions about whether the program is making a difference for participants. Both types of evaluation are grounded in clear objectives. An objective should describe one clear activity and one measurable change within a defined timeline. Objectives are most useful when they use the SMART framework, meaning they are specific, measurable, achievable, realistic, and time-bound. This helps ensure that the evaluation is not just descriptive, but it's actionable. It provides information that can guide decision-making and improvement over time. Next slide. All right. So this slide shows the evaluation plan template filled in with our example. For process evaluation, the coalition starts with inputs. They ask, was the referral tech platform available to all partners? To answer this, they use an indicator like signed data sharing agreements. They also look at activities and outputs. For example, how many trainings were conducted? These are measured using training attendance logs and referral documentation. From these, we identified a clear objective, hosting 3 provider trainings for a number of staff by month 4 of the program. So we can check on our progress during those 3 months with these target numbers in mind. For outcome evaluation, they begin with short-term outcomes. They ask, to what extent did provider knowledge and confidence increase? This could be measured by using a pre- and post-training survey. At the medium-term level, they ask whether referrals resulted in enrollment like SNAP, WIC, or other resources, using program data to track outcomes. This then led to our outcome objective, which measures successful participant enrollment during the life of the program and with a goal of, let's say, 50%. You'll notice that our template does not include long-term outcomes. At this level, you might want to ask whether your program contributed to broader changes, like improved food security among families and young children in the county. This often needs larger data sources or longer periods of evaluation. It's important to recognize that tracking these types of long-term outcomes may not always be feasible given your timeline, resources, or scope, and that's totally fine. The goal here is not to require you to measure everything, but to help you understand how your work connects to these larger system level changes. Even if you're not directly measuring long-term outcomes, keeping them in mind can help guide your program design and ensure your efforts are aligned with broader food security goals. For our coalition in this example, they decided to conduct evaluation up to the medium-term level. So taken together, this evaluation plan creates a streamlined approach for learning from the program, making adjustments and showing impact over time. Next slide. All right, the final step. The final step is where everything comes together. The purpose of step 6 is to turn your ideas, decisions, and plans into a clear and organized path forward. At the end of this step, you will have an action plan that outlines what needs to happen, who is responsible, when tasks will take place, and what resources are required. There are 4 main parts to this step. First, outlining program tasks with defined roles and timelines. Second, developing an estimated program budget. Third, finalizing the full action plan. And fourth, discussing next steps, including sustainability and ongoing coordination. Throughout this entire process, it's important to gather feedback from partners and community members. This will help strengthen the plan and ensure it reflects real-world conditions. Next slide. Here, in our model example, the coalition organizes their work into a clear structure using the toolkit sub-steps and templates. For roles and timeline, they use the Gantt chart in the roles and timeline template, and they map out activities, sequence tasks, and assign responsibilities across partners. This helps ensure clarity around who's doing what and when. They also develop an estimated budget that reflects the resources needed to carry out the work. They include budget categories such as personnel time, program supplies and materials, tech costs such as the referral platform, and data and evaluation activities. Beyond initial implementation, the coalition also plans for next steps. This includes establishing program management systems to support day-to-day operations, identifying pathways for sustainability, and planning how to share information about the program with the community and partners. The toolkit will point you to several resources for these types of tasks. All of these elements help ensure the program is not only launched successfully, but is maintained and strengthened over time. Next slide. Excellent. So finally, all our components are brought together into a single streamlined action plan. This slide shows a skeleton of what the completed program action plan template would look like for our model example. This includes a program overview with a clear title, lead organization, and partners involved. It summarizes the program's purpose, connecting families with young children to food resources through a screening and referral process. It also clearly defines the community need, priority population, and geographic scope. The plan then shows alignment with the strategic plan, including the selected focus area, strategy, and tactic. From there, it incorporates the full logic model along with the detailed timeline, assigned roles, and budget. The plan also includes the evaluation and intended impacts, making sure there is a clear approach to learning and improvement. Before finalizing, the coalition shares this plan with partners to gather feedback, identify any gaps, and refine their approach. Once finalized, this action plan becomes a living document, guiding implementation, supporting coordination, and helping the team stay aligned as the program moves forward. You can think of the action plan as your storytelling reference doc for your program. It can be a great way to communicate your efforts with funders, potential partners, staff and volunteers, and also your communities.